Hello, my name is Gabrielle Osorio, and I am in the class Informatics in Healthcare at Aspen University. The topic that I will be presenting to you today is on the subject of neuronavigation. I have chosen this topic for the final assignment for this class because of its relevance to my current nursing practice. I work as a circulating nurse in the operating room in the specialty of neurosurgery. One of our top technologies on my unit is the use of neuronavigation and intraoperative CT and MRIs, so I wanted to learn more about it. The objectives that I will be going over today are to describe healthcare informatics and neuronavigation, describe the advantages of neuronavigation, to give examples of procedures that can be used with neuronavigation, to explore ethical and legal issues related to the topic of neuronavigation, to explain any changes that would be necessary for implementation of neuronavigation to a facility or unit, and to explore the future of neuronavigation in healthcare. So how does the topic of neuronavigation combine with healthcare informatics? Informatics is a process in healthcare where data is collected, costs are cut, improvement in quality care is given by the combination of technology with healthcare services. Healthcare informatics draws from different fields such as information science, cognitive science, and computer science. And this is the reason that neuronavigation is considered part of healthcare informatics. One of the main uses of neuronavigation are computer sciences and imaging modalities. Imaging modalities such as computer tomography and MRI cross-sectional images are used to create what is known as neuronavigation, which helps to pinpoint tumors and other targets during surgery. So currently, neuronavigation is used in the field of neurosurgery by combining computer systems, navigation tools, and the images that are received from CT and MRIs to pinpoint targets during procedures. This technology can be used with many different areas of neurosurgery, including cranial procedures and spinal procedures. The technology has been through many different stages and has progressed over time to use frameless systems and low-profile navigational probes. There are many advantages to the use of neuronavigation in surgery, and it has provided a way for patients to receive safer care and more precise care. Neuronavigation assists the surgeon in choosing the appropriate size and position of the cranial incision. The length of the surgery is reduced with the use of neuronavigation because the surgeon knows exactly where they are targeting, so they don't have to spend as much time looking for the tumor or whatever it is that they're searching for. And it provides safe intracranial access for surgeries such as biopsies. Some other advantages of neuronavigation are neurological morbidity risk is reduced because the ability to view nearby critical brain structures is given to the surgeon so they can see where they are and avoid touching any other critical brain structures that would cause damage. It also gives neurosurgeons confidence that they are approaching small lesions accurately, and it allows for real-time localization of structures and abnormalities with the use of a navigational probe. There are many procedures that can take advantage of the use of neuronavigation. I have actually seen it introduced into many of our cases in the operating room, and not just cranial cases, but spinal cases, intranasal cases, many different types of procedures, and it's still expanding its use. But I've described 3 procedures here as examples. One example is Ommaya reservoir placement for chemotherapy delivery. A catheter is inserted into the ventricles of the brain as an access point for administration of chemotherapy medications into the cerebrospinal fluid. Many complications can arise during the insertion of the catheter, such as infection, improper positioning, malfunction, or hemorrhage. The use of neuronavigation during the insertion provides greater accuracy and therefore a decreased risk of morbidity. Another example is with endoscopic skull-based surgery for pituitary tumors. Pituitary tumors are often operated on using an endonasal approach rather than a traditional cranial approach. Neuronavigation is especially helpful in skull-based surgeries because it minimizes the intraoperative approaches and risks involved that could result in damage to essential structures. Intraoperative CT and MRI can be utilized in conjunction with neuronavigation to help the surgeon assess for any residual tumor content before finishing the procedure and closing the patient up. One final example of a procedure that uses neuronavigation would be deep brain lesions with microscope-mounted tracking devices. The use of a VBAS, which is a view site brain access system, helps to approach deep brain tumors that are otherwise challenging to access. Neurosurgical microscopes are used to insert and view the VBAS during a deep brain lesion procedure. The addition of a mounted neuronavigation tracking device to the microscope provides the surgeon with continuous visualization and decreases the need for the surgeon to look up and lose his or her trajectory during the procedure. There are a few ethical and legal issues that I could think of that would arise with the use of neuronavigation. One ethical issue that could arise would be whether or not it is necessary for use in certain procedures. Because of the amount of resources that are required and the cost associated with its use, it should only be used by surgeons when it is necessary to improve the safety and accuracy of a procedure. A legal issue that could arise with the use of neuronavigation is the possibility of inaccuracy of the system or of the equipment, and that could result in an injury or mortality. There are some issues that could arise with the use of neuronavigation, and changes could be implemented to improve those practices. Neuronavigation can be expensive, but it is considered cost-effective in comparison to the reduced surgical morbidity and enhanced surgical outcomes. With continued advancements, research, and regular use of neuronavigation, even more cost-effective methods and materials should emerge to make it a more cost-efficient surgical procedure. A shortcoming of neuronavigation is the problem of brain shift during a procedure, which would change anatomical positions and therefore decrease the accuracy of neuronavigation. This problem can be improved by the combination of intraoperative CT and MRI use during a procedure to rescan the patient and re-register the navigation equipment. So to implement a change in practice related to neuronavigation, neuronavigation is not used in every facility or hospital that provides neurosurgery. And some of the places that do use it maybe just have the beginning technologies of it, and they haven't fully reached capacity of what neuronavigation can do. The implementation of the use of neuronavigation would require involvement of representatives from a company who owns the technology and equipment, surgeons and their support staff, such as nurses, physician's assistants, surgical techs, and nurse practitioners, and the hospital or organization who employs these people would have to be involved in the change, as well as a management team. So the first process and biggest process of implementing neuronavigation into practice would be training. To implement the use into a facility, training would have to be given to all of the providers and all of the staff involved. The surgeon would be trained first by the company who owns the technology and equipment. And then he would come into the operating room, and there would be hands-on training that should be given to both the surgeon and the team to assist in learning the procedure. And a company representative should be available to explain everything and to provide answers to any questions. And ongoing training should be given as new issues or advancements in the technology arises. Once the change is implemented, evaluation would need to happen. In-house monitoring of the outcomes of neuronavigation use should be recorded and tracked to evaluate the success of the implementation. Comparisons should be made to the clinical outcomes of previous surgeries versus surgeries with the new implementation of neuronavigation. And the overall flow of the operating procedure by the surgical team should be assessed to make improvements as needed. Financial costs that are related to implementation, it can be very costly because of the many components that are involved, such as computer and a screen, an input device, a localization system, a program for the neuronavigation, tracking equipment such as a pointer, the use of CT and MRI scans, either preoperatively or also intraoperatively, and constant maintenance. There would be many responsible for the cost of the implementation, such as the facility or organization, the insurance company, and the patient. Public policies and technological advances that could affect neuronavigation. The use of neuronavigation could be affected by policies that regulate what types of procedures or with what patients a surgeon is allowed to use the technology on, and when an insurance company is or is not required to provide reimbursement for procedures that utilize neuronavigation. Technological advances will continually improve and change the use of neuronavigation, but also have the ability to decrease the use of neuronavigation if new technologies are presented to replace it.